What we want to do is to take your point on staff. We want to double the number of people training to come into the NHS. There's, I don't know how many thousands upon thousands of vacancies in the NHS. We need the cavalry, the next generation, to come in. So we want to double the training of doctors, nurses, district nurses, you name it. The biggest expansion of the NHS workforce in its history, and we've set out that we'll pay for that by getting rid of the non-dom status tax, which is the way in which very rich people avoid or don't pay their tax in this country. We say we'd get rid of that, use that money directly for the staff. But there are also other issues. I mean, my wife works in a hospital and people would be familiar with the strains on hospitals. We want to move, and we're setting out today how we'd move from a hospital-based approach, which often catches things late in the day, to something which is much closer to home, community-based care, and that will include, for example, 8,500 mental health specialists in our communities, because if you're dealing with something like suicide, which tragically and almost unbelievably is the biggest killer of young people, then we do need that mental health support closer to our communities, and we need appointments that are measured in weeks, not years.
Okay,
and that will be paid for by closing one of the loopholes on private equity.